Today we have no new cases of Covid-19 to report. One probable case already known to us has been reclassified as confirmed following a positive test in the last few days, so that is a probable case that has now become a confirmed case. It means there's no change to the overall total of confirmed and probable cases, which remains at 1,487. I'm pleased to say there are no additional deaths to report. So our total number of confirmed cases rises by 1 and is now 1,137, and this is the number that we continue to report to the World Health Organization. Yesterday, being a Sunday, there were a lower number of tests, 2,473 tests completed. Our combined total to date, 152,696 tests completed. Of our cases, 1,276 are now reported as recovered, an increase of 10 on yesterday, and now 86% of our total confirmed and probable cases are considered recovered. There are today 7 people in hospital and none in ICU. We still have the 16 significant clusters, and 3 of these are now considered closed as there is no longer transmission of the virus within the cluster, and that's a period of 2 incubation periods, so a total of 28 days since those 3 clusters had a case. Clearly, these are encouraging figures today, but it is just one moment in time. The real test is later this week when we factor in the incubation period for the virus and the time it takes for people to display symptoms, which is generally 5 to 6 days after exposure. So that's when we will have an indication if there are any new cases coming through that might be emerging in the community as a result of our shift from level 4 to level 3. We cannot afford to squander all the hard work and effort of the past weeks. We did see at the weekend that it can be easy to start slackening off, and we need to maintain discipline and keep pushing on and sustain the advantage that we have fought so hard for. Today I also want to commend the work on an initiative involving students and staff at Auckland's Marist College. The staff and students will be offered the opportunity to undergo free COVID-19 testing this week in a joint initiative between the Public Health Unit and DHB and the school. While only half of the 94 cases associated with the Marist cluster were directly associated with the college, the others were a result of transmission within families or to others in the community. It's important that the wider school community is given the opportunity to be tested. The testing has been agreed in a discussion between the school board, the Ministry of Education, the Auckland Metro District Health Boards and the Auckland Regional Public Health Service. I'm strongly supportive of this initiative and look forward to following the progress of it during the week. I also want to address the topic of flu vaccination. This is something we've been plugging hard this year, not because the flu vaccine gives any protection whatsoever against COVID-19, but because by vaccinating as many New Zealanders as possible, in particular our older people and vulnerable New Zealanders, that reduces the likelihood that they will get the flu and then suffer the sorts of illness that might put them in hospital. It has been a record year for flu vaccines, with more than 1.35 million vaccines already distributed out to general practices, pharmacies, workplaces and other providers. And this is more than has ever been distributed in an entire flu season here in New Zealand previously. And you will be aware, because we've talked about it, that an additional 400,000 doses of vaccine were procured by Pharmac for this year before the COVID-19 pandemic had even appeared on our horizon. It's been important for us to prioritise those vulnerable groups early on, hence we started the vaccination campaign 2 weeks early, and we continue to just prioritise and make it available for those groups who are publicly funded for a full month. I can reassure those of us who are relatively healthy that there is a very low level of influenza circulating in our community, and I've pointed this out before, that our flu tracker and our monitoring of influenza-like illness is very, very low, a direct result of the period of lockdown we have been under, which has stopped all sorts of respiratory viruses circulating in the community. So the current travel restrictions and restrictions under Alert Level 3 will be continuing that. I'm pleased to say that over 451,000 people over 65 have been vaccinated already this year, exceeding the total number vaccinated in the whole campaign last year in this age group. And likewise, more Māori over 65 have been vaccinated in the past 5 weeks than in the entire year of vaccination last year. Nearly 1.4 million doses of vaccine have been distributed to providers, and as of 30 April, around 700,000 of those were recorded on our National Immunisation Register as administered. So there are still approximately 700,000 doses of flu vaccine out in the community. Some will have been administered but not yet entered on the National Immunisation Register, and others are waiting to be administered around our 1,000 or so general practices, several hundred pharmacies that have accredited vaccinators, and a range of other providers. And of course, there have been challenges around distribution of stock, but any GP or pharmacy that has run out of stock at this point and still has at-risk people requiring vaccination should get in touch with their local immunisation coordinator, who have been coordinating the process of redistribution and or prioritising access to the next shipment of vaccines when it arrives. And just putting that in context, remember that there is only 1% of the pre-COVID-19 number of international flights being undertaken. So we've worked hard to get a priority for those next 2 shipments of further vaccine, which are arriving this week and next week. To conclude with 3 important messages. First of all, if anyone has cold or flu-like symptoms, however mild, please do seek advice and ask about getting a test as quickly as possible. This is the point in time when we want to find any residual infections that could be COVID-19 out in the community. Please also check that your phone details are up to date with your GP practice, and that will help if there's any need for us to be able to contact you as part of contact tracing. And I guess my final important message is to thank all of you, as I have before, in the media for the important role you have played over the last 3 months in supporting our collective efforts to keep the public informed, to ask the important questions and the hard questions, and to ensure that we are being held to account for answering those.